Good morning, everyone. It is Monday, so it's time for our Medical Minute segment with Colorado Springs Orthopedic Group. And we're here with Dr. Jones this morning, and our topic today is ACL tear and reconstruction. So to start off, can we explain a little bit about what the ACL actually is?
The ACL is one of the main ligaments in the knee. There's 4 main ligaments, and the ACL it's probably the one that's injured the most, but it's also the most important. It really prevents the knee from being unstable if you're trying to plant your foot and pivoting or twisting.
Yeah, and I hear it a lot with athletes that they tear their ACL. I think that that's a really big one that we see this injury happen. So is it usually just, you're kind of tripping over your legs too much, or how does it really happen?
Most of them are sports injuries, whether it's skiing or court sports or field sports. But the vast majority of these injuries are actually non-contact. If you're skiing, you fall and ski doesn't come off. Mm-hmm. So it's always important to make sure that you check your DIN settings and all that on your bindings. A lot of times in sports, it's somebody's planting their foot really hard when they're going really fast to pivot, and it just gives. But it can be a contact thing too, where another player hits your knee and blows out the ACL.
So some of these situations, I'm thinking you can't really do anything to prevent those, but there are some ways that you can lessen your chances of having this happen to you.
Oh, absolutely. Proper conditioning program, strengthening program. There's actually very specific ACL prevention programs out there that teach people how to jump better and land better and cut better, which is definitely worth investigating.
If this injury does happen to us, what should we do once that happens? We come into you guys?
Yes, absolutely. And actually some of the worst things I see, and I see it over and over, somebody has something like this happen, they feel their knee pop, it swells up, it's sore for a while, but then within a few weeks it starts to feel better. And that's always the case. Then they go back out and they try to do their sport again, and then it really buckles and gives way. And that second hit is where they cause a lot of that extra damage. So I see that all the time. So if you injure it, especially if you feel a pop, get checked out.
Okay. And so then what are some of the treatment options that we'll see when we come into you?
Well, if it is a complete tear, it is almost always a surgical problem. You just can't get back to sports and pivoting type activities without an ACL. And most of the time it's a reconstruction where we have to rebuild an ACL. There are certain situations where you can actually repair it. But it really just depends on the situation.
Well, thank you so much for being here with us today and sharing that information. Hopefully, fingers crossed, that doesn't happen to us, but at least we know we have you guys here if it does. So thank you so much. And you can go online for more information at csog.net.